According to the main chapter of the National Alliance on Mental Illness, 2 in 5 adults experienced mental health symptoms in 2021.
That is nearly twice as many since the pandemic started. And with more people in need of care, News Center Maine's David Guilford reports on a hopeful sign of relief in one part of the state.
Midcoast Mainers needing mental health care will hopefully find better access in the near future.
It gives us additional funds to hire more staff. Hiring more staff allows us to provide more service.
Jane Van Bramer, the CEO of Sweetser, explained how a new $4 million federal grant will bolster staff and services, including crisis care and substance use treatment at the nonprofit's Brunswick office.
I think the need for behavioral health services has never been stronger, whether it's the outcome of the pandemic or whether it's the fact that there's less stigma associated with receiving behavioral health services.
I am really excited for Sweetser and for that northern Cumberland, Lincoln County area.
Greg Marley from the main chapter of the National Alliance on Mental Illness is thrilled with the investment because, he said, families and individuals still struggle to get proper care.
It's been slowed down by the pandemic at the same time that the need has been radically expanding. And there's a lot of wait lists.
Everybody deserves rapid access to mental health care. You would want it, I'd want it, right? It shouldn't be call back in a month and we'll see if we can help you.
25 years, Sweetser doctor Mark Kaplan is thrilled and is already recruiting 2 psychiatric positions.
The only reason people are on wait lists is because when you don't have enough staff to bring them into care. All right. So we are now able to, thanks to the grant, we're able to bring people into care.
Van Bramer and Kaplan are still figuring out just how many people they'll be able to hire, but down the road, Marley says the crucial next step is always keeping programs funded once the grants end.
How do we sustain funding for a level of service and the types of services that people need? That's the only concern I have.
David Guilford, News Center, Maine.
And according to the National Council for Mental Well-Being, service has increased sharply nationwide from 1.5 million people served by community behavioral health clinics in 2021 to more than 2 million right now.